Good evening and welcome to Slam the Gavel, the show that tells it all regarding family court, other court issues, as well as CPS. I'm your host, Maryann Petri. There's a non-denominational retreat weekend at the Resolution Center of Jacksonville, Florida. This will be a time of support and renewal for parents and grandparents on the journey of parental alienation, standing strong in resilience, paving the way for good health and a great future. This will take place April 22nd through the 24th at the Resolution Center of Jacksonville, Florida. I will have all the details in the podcast notes. I have a brand new guest. Her name is Dr. Susan Ilkov-Moor. She's a geriatric psych doctor. She is also an alienated mother. She is from Kingston, Canada. She graduated from med school, geriatrics, Queen's University in Kingston, and she has been in practice since 2006. And she works primarily with dementia patients, but also patients experiencing psychotic depression. But we're going to talk more into that as well. And I welcome you to the show, Dr. Susan. How are you?
Very good. Thank you. Thank you for this opportunity. And I certainly work with all psychiatric disorders, but you have definitely captured the vast majority. Thank you.
Mm. As far as like dementia goes, you know, these people, do they start with dementia like in their 50s, 60s, and then they end up with you?
Well, certainly the highest incidence of dementia is in people's 80s. So between 80 and 85 is actually the highest rate of developing dementia at a rate of 1 in 3 people in the population, which is astounding, actually. And surprisingly, it goes down after that. So if you live to 95 or 100 without getting dementia, you will not get dementia, except for perhaps having something like a stroke and actually surviving it, which is rare at 100. So there seems to be an age-related aspect to all dementias. Dementias that are early onset, meaning before 60, are thankfully fairly rare. The youngest person I've seen with dementia was 29 and has since passed away of this rare genetic disorder.
Oh, that's terrible. I never would have thought, because as we talked earlier, I had been a psych nurse, and I primarily worked with adults, but then they merged the units of the geriatric unit along with the adults. And, you know, I wasn't really working a lot with them unless you were assigned to a patient, but that's very fascinating. I never knew you could get it genetically at 29. Oh.
Yeah.
You know, and I'm sure with a lot of patients, there's a lot of depression. It seems like as older people or as people age, maybe they get more depression, do you think?
So there's quite a divergent view on that, in fact. When people do get depressed, it does seem like depression is often more severe, and there is a psychotic component, which is often missed. However, in actuality, there's a lot of research to support that people become more emotionally stable and happier as we age, which is a really fascinating population based view. So it's just a wonderful thing to see most people being quite contented when they unfortunately begin to suffer dementia. And it's complicated because, of course, when someone starts to lose their capacities, their faculties, depression comes. And that's a pretty expected outcome. I mean, dealing with loss is not easy. And dealing with loss that is irreversible
Mhm.
is a really hard place to be. And so we can certainly have depression
Mhm.
at the same time.
Mhm.
Yes.
And you probably see, family members come in and try to, talk to their parent or grandparent, and, I don't know, as it went, at least with my grandparents, there was like, they would just stare at you. You know, I don't know,
Yeah.
they
Yeah.
just, like, lost it or what, but
Yeah. 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 So with dementia care, we talk about two deaths. We talk about the death of the soul, and that's when you're staring at that person and they're gone.
Mhm.
They're really gone, and it's just absolutely heartbreaking. And then there's, of course, the death of the physical body. But the death of the soul, and we experience that in moments with dementia. It's an absolutely crushing experience for loved ones, watching their loved ones dement. Um, it really shows that lack of resonance, that lack of attachment that has occurred as a part of this disorder.
Mhm.
And it's really a huge part of loss of quality of life and suffering, in fact,
Mhm. Mhm.
for both caregiver and person.
Oh, it's extremely difficult, especially if you're dealing with, maybe schizophrenia in the elderly. I don't know how many cases, if you see a lot of schizophrenia or bipolar.
Hmm. So I have a minority of patients with both
Mhm.
disorders, um, and certainly I'm fortunate in that I see very few patients who have aged in to my age group from an earlier onset.
Mhm.
So I would only see those individuals if they were now struggling with cognitive impairment. And I'm fortunate I can provide a consultation and they would return to their usual psychiatrist for
Mhm.
care. Um, but when I care for people with bipolar disorder or schizophrenia, it's typically that they've developed their disorder after the age of 65.
Mm.
Um, it's remarkable how many of these people whom we diagnose with these disorders within 5 years, unfortunately, progress on to dementia. And
Hmm.
that was their maybe sign that they were going to have this disorder. So even when people present and we diagnose schizophrenia, there's a subset of them that convert. It's a complex relationship, cognition and schizophrenia. Schizophrenia was originally called dementia precox because in those who suffer their first episode of psychosis, there's also a loss of cognition. There's especially a loss of that frontal lobe, of the capacity to plan and sequence and coordinate life that people with schizophrenia suffer. Whether that drop continues to progress downward
Mhm.
or not is what every psychiatrist is fighting.
Mhm. I know with, the patients that we had, we would put them on Celexa to, lessen the depression, but also help them eat because they would stop
Yes,
eating.
yes,
Hmm.
absolutely. Are you speaking of people with schizophrenia or dementia. It's certainly used in both for.
Both, yeah.
Mhm, mhm.
Yeah, and it seems like a whole big realm of depression.
Well, I like to think of it as comorbidity.
Mhm,
So, in mental health, it is rare that a patient has a single diagnosis, and they're very fortunate if they do.
mhm,
Um, it is much more common that one disorder worsens another and causes another.
mhm,
So, for example, a person with schizophrenia can, at a later time, once stabilized, become very depressed over their disability.
mhm,
So they then have an independent mood disorder with schizophrenia. They can have substance abuse, and they
mhm,
commonly do. They can have a dementia develop. So many people have many diagnoses, and if we get really nitpicky and look at phobias and all of these things that people might have, uh, many people can have many diagnoses. Now the question comes, is it impairing function?
mhm,
That's the big question. Because if it's not affecting life, we shouldn't touch it.
mhm, mhm,
We shouldn't touch it. If it's not distressing, if it's not um, impairing and impacting relationships and daily function, we should leave well enough alone.
mhm. Right, if it isn't broke, don't fix it.
Yeah, even if it's there.
Right, right. Definitely, and it's like, with, some grandparents, do you see grandparents that are, I know we're branching off into another subject, but, grandparents that are alienated, do you see a lot of that? Family dynamic.
Well, I see many family dynamics.
Mhm,
Certainly, alienation is one of the dynamics I see. It is one that can cause a great deal of heartache for grandparents. It can, and I've certainly seen this, cause depression. It can cause psychotic depression.
mm,
It can be severely exacerbated um, when somebody receives a terminal diagnosis, such as dementia, knowing that there may never be contact again.
oh, that's so sad. Yeah, it's heartbreaking to see patients go through this. I mean, I remember driving home and just, you know crying at the wheel, and it's like, "Geez, why do people have to suffer like this?" And, it's there's nothing, like, as a nurse, you could really do, just give, comfort and, um, just be there for them. It's really unfair that these things happen, and there's no rhyme or reason to it.
Hmm. Yes. Yeah. There is, I mean, there's often um, a history of trauma within the family.
Mhm,
And to be frank, um, if we were to look at it as a spectrum, I would say the vast majority of us as a population have had some type of trauma, certainly attachment trauma,
mhm,
which is exactly what parental alienation is a type of.
mhm. It definitely is. It's very heartbreaking, and people don't understand how other people can be so cruel to put
Mhm.
any parent or grandparent through this.
Yes, and especially a child,
Mhm. Mhm.
a vulnerable child. Yes.
yeah, who doesn't understand why they're being taught to hate or fear that other parent. It's child psychological abuse, and the
Mhm.
parents. And I've also heard that grandparents participate in also alienating the child as well.
I believe that to be the case. I have not personally been involved professionally in that type of scenario. And probably I would not be,
Mm-hmm.
simply because that kind of grandparent has a lot more capacity than my patients do.
Mm-hmm. Mm-hmm. It's just we've got the patients that I had seen were just in those geriatric chairs, just just sitting there and staring. And I remember going in to see my grandmother, and she was saying, "Oh, you know what? My granddaughter makes these really beautiful quilts." And it's like, but that's me. And she didn't realize. I mean, she was out of it. It's so sad to see that.
It is sad to see that. I ask family members to move beyond that
Uh-huh.
and reflect on our patients' perspective, in
Mhm.
that she sees this lovely lady and she wants to share um, the love that she's experienced from her granddaughter with this lady,
Mhm.
and simply identifying that emotion and
Mm.
being in agreement with the emotion is really where to go. And you'd be surprised with something like, wow, that is just so beautiful.
Mm.
You are so lucky. Grandma,
Mhm.
it's
Mhm.
me. I
Mhm.
made them for you. Can you believe that? It's me.
Yeah.
And
Yeah.
that just brings joy and laughter and hugging. It's a logic-free world.
Mhm.
And if you just go with that emotion instead of swinging with the logic,
Mhm.
um, you often get wonderful results with people with dementia.
Mhm.
Now, there are times when it's a delusion and
Mhm.
you probably shouldn't feed into it.
Mhm.
But when it's simply forgetting and misidentifying like that, um, going with their emotions in the moment is absolutely the way to go.
Mhm.
Um, it brings to mind that because people with dementia, um, if they're feeling well, don't live in the past and they don't think about the future, they're often living in the present.
Mhm.
And because of that, you can have exquisite moments of joy and authenticity with them.
Mhm.
Um, and it's a wonderful place to be. It's very freeing for families to be able to get there with their
Mhm.
loved one. I have seen people with dementia who, for the first time, do not need to worry about whether the house is clean, whether the dinner's been made, whether the bills have been paid, and they are the happiest they have been in their lives because they can let go
Mhm. Mhm.
and live in that moment. So there can be some wonderful moments, but you have to know how to get there.
Right. And when I was a nurse, we'd say, "Oh, the golden years." I don't know if there are golden years.
Who was it? Was George Burns who said, "Growing old ain't for sissies."
Right. Oh, very true. Very true.
And I think that's probably the better description than golden years.
Right. Oh, definitely. Yeah, it's a hard road to hoe, to
Yeah.
get up there, and it's some people don't make it that far, and that's another topic, but it's these patients that are in these nursing homes, and their families, their families sometimes just don't even come to see them, because maybe the family member, I don't still want to go into a hospital. I don't like hospitals. I don't like nursing homes. And it's like, it's not that patient's fault. You don't like going in there.
Absolutely. Absolutely. There's a lot of loneliness. I mean, pre-pandemic, there was quite a lot of loneliness for people in long-term care, and that has only worsened with the
Hmm.
pandemic.
Hmm. Because that went on in Canada, though, how long did that go on? That was a long, long time.
I think we're still in it. I mean, I can't go into a nursing home without a mask, gloves, and a rapid test on entry into the home before I'm permitted to go see a patient.
Hmm.
So we're still in a fairly restricted environment. We are now allowing more family members to see their loved ones. So
Hmm.
that's a big deal, but it's still 2 or 4 family members in total, not, you know, what it used to be.
Hmm.
Uh,
Yeah,
Very
just
difficult, very
right.
lonely, very lonely.
Hmm. And that also plays in with the family dynamics of, either some fight that went on in the family that happened years ago, grudges that are held. Do these get resolved when they're in a nursing home? Probably not.
No, no, often not. Yeah, those that it has been worsened absolutely with the pandemic.
Mhm.
That there's ongoing conflict that maybe isn't resolved as quickly. Um, it's been very, very difficult to uh, do our usual interventions in terms of involving social work for dealing with relational issues, and perhaps financial issues, which are often the cause of conflict, and so forth. So it's been um, a difficult time to provide care with a multidisciplinary team.
Mhm.
Probably I should clarify that I do work in a multidisciplinary team. So I work with several nurses who are specially trained in geriatric psychiatry,
Mhm.
administrative staff, of course, social work, occupational therapy, physiotherapy, neuropsychology, and social work, psychotherapy.
Mhm.
So quite a few resources there that I can tap into, but you can see how with each additional person, it becomes more difficult to provide care in a pandemic. So
Yeah.
it's been difficult, very difficult.
Mhm. Yeah, it just I don't know how, we all made it through this somehow. I just feel so sorry for these people cooped up in these nursing homes.
Absolutely.
And and sometimes, well, they couldn't bring grandchildren in to see them either. And
We in Canada had a lot of visits through windows,
mm,
grandkids standing outside and waving, and it just awful to walk by as you're going into the home.
mhm, I can't
Just
imagine.
heartbreaking.
Mhm. Because I think the elderly, if they're lucky enough to have a relationship with their grandchildren or even their own children, they need that. that hug. They need that, not to look through a glass window. It's just so sad.
Right. The way that I say that is as people start to lose their ability to speak their mind, they need touch to communicate.
Mm-hmm.
Yeah. Yeah.
So when you get these new patients in, do you go over family dynamics of their past?
Not in that way. So it's really important to know that medicine is aimed at the individual,
Mm-hmm.
right? Those family dynamics are more of the social work model.
Mm-hmm.
And we really in medicine have a ways to go to integrate with environment impacting our health.
Mm-hmm.
We really have a ways to go. Psychiatry is really in the center of that. And it's a very difficult transition. Psychiatry remains focused on the individual rather than the dynamics, probably because we don't see clear interventions that will alter things often in
Mm-hmm.
families. And so we look at it from the perspective of what trauma has the person gone through in their life, particularly in their childhood. Because unfortunately, through a horrible condition called PTSD, many people with dementia can re-experience their childhood traumas as they begin to suffer cognitive impairment.
Hmm.
And so that's an important piece. The other piece is relationships. How have they fared in life with relationships? Do they have traumas? And it often helps us in approach. So if someone isn't extremely rigid, we will want to identify their daily schedule that they've followed most of their life and rigidly stick to it as best as possible to give that person optimal quality of life.
Mm-hmm.
So if they only bathe at night with 3 inches of water in the tub and used a face cloth, we better do the same.
Mm-hmm. Mm-hmm.
And oftentimes there's reasons that are unknown to both the family member and to the client at the time as to what's happened. But unknowing healthcare staff will prepare a full bath and the person will freak because they think they're going to be drowned.
Mm-hmm.
These things happen. So we follow as best we can what life patterns that person has.
Mm-hmm.
We do look at that. And part of that is, of course, their social interaction. So how do they relate with others? And are they best with a more directional, okay, time to go now, let's go?
Mm-hmm.
Or are they best with, would you like chicken, beef, or meatloaf for dinner tonight?
Mm-hmm.
Do they need options? Do they need care in a specific way? So we're
Mm-hmm.
very nitty gritty about what we call a behavioral care plan.
Mm-hmm.
Yes.
Do you ask them about their relationships that with their family members, as far as their children, as far as if they're in intact relationships?
Absolutely. Absolutely. Truly, the number one indicator of outcomes in dementia
Mhm.
are the caregiver relationship with the patient. This is beyond all other interventions. This relationship, especially, is important, but that person's way of relating is absolutely very important as well. Uh, because we must be mindful of how they are. Often people with dementia are not going to change very much. So it's really up to us to ensure that we approach appropriately, that the environment is calm and soothing and non-triggering, and so forth.
Mhm. Have you ever had a family member tell you that, well, mom or dad is here and you won't be seeing me. I'm not coming to visit.
Absolutely. I have
Mm.
had family members refuse to make decisions when their loved ones are at risk. For example, making decisions to apply to long-term care when we've been in and there have been recurrent house fires.
Mm.
And certainly in those situations, we have steps where we have to move forward in attempting to contact, and then moving forward with, in our area, what we call public guardian and trustee, which is a public person that steps in to make appropriate and safe decisions
Mm.
for a vulnerable person
Mhm.
in the community. Um, and I have had to, unfortunately, be involved in involving the public guardian and trustee on
Mhm.
a few occasions over my many years of practice. Usually, we can cajole family to move towards doing the right things.
Hmm.
We work fairly collaboratively with home care and other community services. So oftentimes when we are all presenting the same perspective and promoting action repeatedly, it often gets followed through.
Mhm. Yeah, it's just, it's difficult with family dynamics when I worked as a nurse because you would see, you know, people come in and visit for maybe a couple minutes and then leave, or some family members would stay the whole shift. Yeah, it's every family is different. Some families are lucky that, no traumas or, tribulations ever struck their family. I mean,
Mm,
even as far as it, you know, um, family court or whatever.
yeah, 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 yeah. So those are the families that are really very capable of practicing acceptance
Mhm,
and moving forward with the best options, really being rational, being calm, being loving
mhm,
in very difficult times, and making the best of the situation. And I mean, I've seen many other reactions, of course, anger,
mhm,
denial, threats.
mhm,
I've had it all. I've had it
mhm,
all. I love it when I get called a crazy psychiatrist because usually it means I'm doing the right thing.
mhm. Right, right. Yeah, if they don't like, what you're doing it right.
uh, it's
Yeah.
it's funny. Every time I've been called that in my clinical practice, it's like, oh my gosh, you cut the dog's tail off. Of course, I'm doing the right thing and putting you on a form and putting you in hospital. You're not well.
Right,
It's
right.
so obvious that the person is unwell when they say stuff like that. That it's hard. Now I've seen speaking about family dynamics, because I think that's, let's go back to that. Family dynamics are always present. You see everything from neglect to total enmeshment. You talked about, the families that are so uncomfortable with what is going on that they simply can't be in the presence of that ill member of the family or group. And then people who feel so guilty that they somehow feel responsible for that person's mental illness and spend every waking minute making atonement for their guilt and shame. And that is very unhealthy, not only for the family member, but also for the patient. It's remarkable how often the family dynamic can exacerbate or perpetuate mental illness. And I'm very fortunate to work in that collaborative model where we're able to address some of those dynamics and help people relate in healthier ways.
Mm-hmm. And I think it's difficult when you see a grandparent that is alienated from a grandchild, and I don't know how much they talk to you about that when you're on the floor, or if the nurses mention it to you, or what's said. I mean, because when I had worked, we would tell the doctors everything, what the patient had told us.
Mm-hmm. Mm-hmm. So yes, absolutely. I usually find out from nursing staff about alienation. It's often experienced as a real heartbreak.
Mm-hmm.
It's really a form of helplessness for my patients. And at that time, I find often bringing in spiritual care from their denomination, if they have one, somewhat helpful in gaining acceptance of this horribly abusive and heartbreaking scenario for them.
And it's like,
and I mean, I can speak to my own parents who
I'm sorry.
both miss my son. Yeah, my father is now suffering from dementia as well. So
that's so sad.
I experience his heartache.
Oh, I'm so sorry. It's so unfair that people.
Yeah, it's particularly unfair because despite losing many capacities, he still retains awareness of his loss.
Yeah, it's very like abusive to all involved.
Yeah. Yeah, which really brings it to, I think, back to the legal system and its failure.
Right.
Because as we know, the people who cause alienation are a part of our population. They are normal variants of our population. And in fact, they serve a purpose.
Mm-hmm.
However, when appropriate boundaries are not put in place, excessive power can lead to corruption of a mind and a system. And without a system that practices awareness, that I have to say the legal system is absolutely a shock to me, coming
Mm-hmm.
from the medical system, where we are continually reviewing our outcomes and reviewing which variable caused the improved outcome,
Mm-hmm.
and promoting increased utility of that variable.
Mm-hmm.
To see the legal system be oppositional, be frankly childish,
Mm-hmm.
and be really, the word I can come up with is bully. My
Mm-hmm.
experience of court was very well displayed in the movie Idiocracy.
Mm-hmm. Yeah, it's
Um,
a disgrace.
the court system, I mean, you will see me on Facebook. I call it the family court, the cash cow family court circus, because they do not have governance, they do not have oversight, they do not have self-regulation.
Exactly, and along within those words, the accountability that these judges
That's
are
what governance and self-regulation is
Yeah,
all about,
yeah.
and they've got none of it.
Mm-hmm.
They're a circus.
And they don't care that they're hurting these children, and they themselves are child psychological abusers.
Absolutely. They are a systemized, monetized, for-profit child psychological abusers. Mm-hmm. They're sex traffickers, as far as I'm concerned. I know that's a horrible thing to say, but I think a subset of alienated children are certainly sex trafficked,
Mm-hmm.
and I have a lot of concern about that. Any organization that supports even a subset, when it is in such an organized way as the legal system does,
Mm-hmm.
is in fact a child abuser.
Mm-hmm.
Yeah.
I was interviewing Kenneth Gottfried, and he's written 3 books on the legal system, and also the American Psychological Association too. But one of his books is Child Abusers in Black Robes.
Yep.
And that's exactly what I was dealing with. And I think a lot of parents, and yourself had dealt with, it's hard to see and look at a judge and think he's going to do the right thing. Because when we're kids, we're thinking, and we're being taught they're going to do the right thing because, that's what they should be doing.
Yeah. Well, I had a judge tell me when my son was 16, not attending school, despite his IQ being in the 92nd percentile,
Mm-hmm.
And having mental health problems, having had suicidal ideation in the past. And I was told by the judge that not in his 30 years had he ever seen a child change custody at 16, and it wasn't going to happen now. So basically what he was saying is, I'm going to do the exact same thing I've been doing for 30 years, and I do not need to learn to do anything better.
Mm-hmm.
That's failure. That is
Mhm.
a system in failure.
This is a global issue that we're
It
having
is.
over here
It
too.
is. It is. It is a global issue everywhere. It attracts a certain personality type,
Hmm.
and it is governed by politics.
Hmm. Most definitely.
Which is a real, which makes it capitalistic. Essentially, that's the bottom line.
Hmm. Hmm. Yeah, and the kids are paying the price
Absolutely,
because when this parental
and in
alienation,
fact, we are paying the price. We
right?
are paying the price because in perpetuating parental alienation, we know we are perpetuating prisons. We are
Hmm.
perpetuating the mental health industry. We are perpetuating the self-help industry. We are perpetuating other industries, which I am not going to mention
Hmm.
today.
Hmm. Oh, I agree with you. I agree with you. Um, I was talking with another doctor, and with this parental alienation, it causes mental illness in that child too. It perpetuates that. Um, I was also listening to some woman on TikTok, and she was talking about is it the, I know I'm not going to pronounce it right, hippocampus. I cannot, but it
Oh, yes,
shrinks.
correct.
It shrinks in these people that are abused.
Absolutely. Yes, the hippocampus is a very sensitive part of the brain. It is damaged irreversibly in dementia. The cells die preferentially there first. It is decreased in depression and regains its volume when we treat depression and people recover.
Hmm.
It is damaged in trauma and again can be repaired.
Hmm. So this hippocampus, I know I'm not pronouncing it. So this can rejuvenate itself. It's
It
fixable.
so there are certain types of um, cells that we think are rejuvenating themselves. So
Mm-hmm.
in depression, we actually believe the fat cells are the cells that are dying off or
Mm-hmm.
are maybe less fat. And so the neurons aren't firing quite the way they used to because the connections are, if you say, a little bit faulty.
Mm-hmm.
So it's like a faulty wire. The light switch may or may not work
Mm-hmm.
in depression, if you can think of it like that. In dementia, the cell is dead, so there's no recovery.
Mm-hmm.
But we believe in depression, the neurons themselves do not die.
Mm-hmm. Because I've got two children that are alienated from me, and I
Mhm.
wonder if with what's going on and what's going to happen in their brains, if that if they will if this can recover, well, if they'll figure this out, you know because I don't know if they'll figure it out or um, come into a realization what really happened and how they were used as a weapon. I don't know. I mean, other parents are sitting here, we're all questioning when they will return, and hopefully they will. And
Mhm. Mhm.
I prepared myself that they may not. I don't know. It's in
I
God's
think
hands.
I think in my situation, um, I have had to have my son's funeral
Mm,
to move on
mhm,
with my life. Um, because living in perpetual anticipation and hope is very, very difficult. And I think that it may be helpful for other parents to consider doing the same thing. There is no guarantee that our children will become aware. In fact, we know that these conditions will increase the risk of they themselves developing personality disorders. We know that 50% of them will also be alienated. And likely a large portion of the rest are involved in alienating. So we, I think, have to have a lot of acceptance that the children we lost are gone in some way. And we have to wish them well. And hope that they come and realize what has happened, and hope that in that realization their suffering is decreased. But I think we have to have acceptance that our children are not going to live up to their full potential, most likely.
I agree with you, yes.
And that's a really hard place to be.
And for a parent to do this to their child to spite the other parent, they are the beyond child psychological abusers. You know, I mean, this is just, you know, they have a lot to answer to God for. They've literally destroyed a human being that was normal, happy, and healthy, and mentally healthy.
Yeah. Yes, they did. However, we also have to have some compassion for whom they are. They're often extremely injured, thwarted individuals who have not dealt with their own childhood trauma and are unable to cope with their own shame and guilt, and so have divested it onto their children. And now their children must bear the guilt, shame, and hate that they themselves cannot process.
Yeah, it's very sad. I'm glad we're having this talk because it's Parental Alienation Day on the 25th of April.
Yes, absolutely.
And as parents and all of us that are alienated, we have to pull together. I tell people to have a hobby, find some new hobby that you haven't done before, do something creative. You have to live for yourself. And
my advice to alienated parents is to do inner child work, heal your inner child, find love for yourself. A great help would be the Real Self-Love Handbook by, I think, Dr. Andrea Paddington. It is just an amazing book about what are our virtues, what are our values, What are the positives about us as well as the negatives? What are our accomplishments and our setbacks? And it's a really heartwarming
Mhm.
self-reflection, um, and really, it's an amazing self-love is an amazing way to regulate
Mhm.
your own emotions.
Most definitely, and that also goes along with self-care and just,
Mhm.
sometimes you have to baby yourself. If that means sitting on the couch and watching a movie you've watched 20 times because you really didn't get to enjoy the movie for the last 20 times because you're constantly being interrupted.
Yeah.
But that's, just do what you want to do to relax.
Yes, absolutely. And it's a journey. Life is a journey.
Mhm.
We have to be very kind with ourselves.
Mhm. Definitely, and it's also made me kinder towards others.
Yes. It can also make you extremely bitter, and
Mhm.
it's a place to be for a while,
Mhm.
but then it's time to um, not allow our emotions to drive our life, but to drive our life and to regulate our emotions.
Mhm. Mhm. Well, I'm so glad I had you on. What advice can you give a parent, um, going through this at all?
Yeah. Um, Alienation is extremely difficult. The first role that you have is to regulate your own emotions. The sooner you can do that, the better your chance of regaining your relationship with your child.
Mhm.
Um, there's a huge power dynamic going on, and it's a mirage. You've got to
Mm.
gain your power back. And number two is have those great times with your kids.
Mhm.
Um, Confront um, what's going on in a loving way as best you can.
Mhm.
Forgive yourself if you make
Mhm.
mistakes, because every parent makes mistakes. And although alienation is about amplifying every micro mistake you have, you deserve forgiveness
Mhm.
because no one's perfect.
Excellent. Excellent advice. I totally thank you for coming on, and I'd like you to return, and we can talk again as well. And, don't jump off. Oh, where can people locate you? I'm so sorry. Where can people locate you?
So, probably the best place to locate me is on Facebook, and it's Susan Ilkov-Moor, Ilkov-Moor.
Great, great. Well, don't jump off. Slam the Gavel is a podcast to help the public understand what really goes on in these family courtrooms that in turn perpetuate parental alienation. I'm your host, Maryann Petri, author of Dismantling Family Court Corruption, Why Taking the Kids Was Not Enough, and Cry Out for Justice, Poems of Truth. Please join us again here with Dr. Susan and other exciting guests. Thank you again, Dr. Susan.
My pleasure. It's been very interesting. Thank you for having me.
Thank you.